Dr. Moore, I believe you said the case in measles from Tennessee was in Memphis, an adult in Memphis, right?
It was actually adult in West Tennessee.
In West Tennessee.
Right, right.
But you described you moved in quickly, and the number of people that just that one case that you had to be in touch with was how many?
124 that people had come in contact with that one case during the 4 days before they were diagnosed.
And this is an area where the vaccination rate for measles is what?
Very good. I don't have the specific number for that region, but it was clear because 124 people were exposed and only 3 people got sick that it was very high.
So it was high. Well, as Dr. Sawyer was talking earlier, I was thinking about the phrase going viral, and then Dr. Jacks used it. I think this generation understands the idea of going viral. You're talking about measles flying through the air. That's unlike Ebola that threw the country in a complete panic, actually, in last fall when we spent $5 billion, changed every hospital's procedures, dominated what was going on in all the public health departments, and that could only be caught by an exchange of bodily fluids. This flies through the air. This goes viral. This is a disease that goes viral. Now, we senators, in a bipartisan way, understand the problem of dealing with highly educated people who get bad information on the internet. That happens to us every day. We deal with that. We know what it is. But let's go back to the going viral. What if this person in West Tennessee, who Dr. Moore acted on quickly, and what if that person had been discovered in a part of Los Angeles where the immunization rate is 60 or 70% instead of 90 or 95%? Describe the number of people and the multiplying of people that would have to be contacted to make certain that the disease didn't spread.
Well, I can share the experience we had in San Diego in 2008, which was our last outbreak. We had 12 cases, and over 800 people were exposed to those 12. So it quickly goes up exponentially, the number of people you have to track, and unless public health is there to track those people and keep them quarantined, it could easily just get completely out of control.
Well, so you had 800 people, but then each of them might have infected someone else, right?
Exactly. In that outbreak, we had close to 100 people were quarantined for 3 weeks just to prevent that next wave. And we're all crossing our fingers here with this Disneyland outbreak that maybe we're near the end. But I noticed that the case number went up by 20 just this last week. So I'm not sure we're done with this yet.
So when you say flies through the air, we have an example of going viral in modern parlance, I suppose. But Dr. Jacks, this may not be an exact comparison, but people ask me why I continued to play the piano when I was young, and I remember responding, I didn't remember my mother giving me a choice about it. I guess I had a choice, and we're not talking about taking choices away today from parents, but we are talking about a conversation with between a pediatrician and a parent that probably wouldn't start without. I mean, even in this day of parents who deal differently than my generation of parents, let's say, how strongly do you recommend to your parents that they vaccinate their children? What's I suppose the most persuasive thing you can do is tell them the story of your own children. But do you just make a neutral observation about it, or do you come to a conclusion and say, I think you should do it?
I definitely come to a conclusion of recommending that we do vaccinate. I oftentimes don't approach it quite that way because I want to get their thoughts and opinions and their fears first, so I can address those. But yeah, I talk to families from a couple that's still pregnant that hasn't had their first child yet, to that first visit after they're born, to the routine visits where we would do vaccinations. Mm-hmm. And every visit, whether they are 100% getting vaccinated or whether they're still trying to decide, I'm answering questions, and I'm urging them to make a good informed decision. And my understanding, my opinion is that, yes, vaccines are absolutely one of the best things that they can do to protect their young child.
I'm out of time, but I assume, I assume that, I know in our state years ago, my wife led an effort to establish a medical home for every child about to be born, prenatal health care. And I assume anything in prenatal health care that allows a parent to know more about the value of vaccinations before the child is born is a very effective way to keep the vaccination rate high. Senator Murray.